Hi there. Imagine this. What was supposed to be a normal routine day at her work at a hospital in New York turned into trying to convince the patient not to blow her nose anymore so she doesn't blow more of the brain cells out of her head. This is an uncommon day in the life of a nose, ear and throat specialist. A real story that happened in 2023. New York. Lay back and have any uncommon drink or snack. Let's give our doctor a fake name called Emily. You see, as an ear, nose and throat specialist, not only cases are very exhaustingly similar, also that the same patient always come back complaining because they think recovery time is taking too long. Meanwhile, what they suffer from is a chronic allergy. Chronic, it's for life. Or they complain maybe the medicine is not that useful and that the doctor should change it. Yes, this was the kind of cases Dr. Emily always had to deal with. On that uncommon day, it was Friday, September 2023, a rainy day in New York. While she was sitting on her desk, came the day schedule. First up, Shimika Rodriguez. The note simply said, persistent unilateral nasal drainage, unclear cause. Nothing seemed unusual or outside the routine cases she always gets. And that day was not busy. Shimika was the first patient. When Dr. Emily walked on Shimika, she looked exhausted. A tissue was jammed into her nostril, a desperate attempt to stem a never-ending drip. Before even saying hi to Dr. Emily, she mumbled that the fluid drained constantly from just one side. As she leaned forward, a thin crystal clear water came dripping out of her left nostril. It was clear water, not a mucus, not a green or yellowish fluid, only a crystal clear stream of water pulled out of her left nostril. When she saw her medical history, plus what Emily told her, that she have seen more than 5 doctors in the last 2 months, and she got diagnosed with allergy, virus, bacteria, which she took medication for all of them, but nothing really worked. When Dr. Emily learned about all this, she knew right away that this was not a usual case. Her stomach sank. She said quietly, don't blow, don't move too fast, don't lean forward, and don't blow your nose anymore. You could simply be blowing brain cells out of your skull. She told her, I'd seen this before. Once, twice, and when I look you in the eye like that, you know I'm serious. Now, Dr. Emily tried to dig in more information that is not mentioned in the medical report, something the 5 previous doctors may have missed. Meanwhile, she asked her to collect some of the fluid that was running out from her nose into a cup and sent it directly to the laboratory. But what was going on Dr. Emily's head? You see, crystal clear fluid that has been dripping for almost 2 months. She took antihistamine, she took antibiotics. They thought it was a virus, and the symptoms only kept getting worse. You see, Shimika complained that she couldn't sleep anymore in a horizontal way because anytime she falls asleep, she would wake up choking on her own fluid coming from the runny nose. She had to sleep with her head very tilted upright. Whenever she kneeled down, she would have a strong headache. She would lose her balance. She always felt dizzy. When Shimika was telling her all of these details and symptoms, Dr. Emily felt a knot tighten in her chest. Clear fluid dripping only from her left nostril. Worse when she leaned forward, sometimes overwhelming her throat when she lay down. She said dizziness and pressure sensation had begun recently and becoming day by day stronger. What was going on Dr. Emily's head? The diagnosis she feared that this water is a cerebral spinal fluid water somehow dripping from an unknown hole and reaching the nasal cavity and dripping outside of her nose. It was never an allergy, never a bacteria or a virus. It's coming from the cerebrospinal fluid. You see, the cerebrospinal fluid goes in a specific enclosed pathway and protected, covering all the spaces between the spinal cord and the brain, and act as a cushion to protect the brain from any shock, any trauma, or any movement against gravity, to prevent the tissues of the brain from touching the bone of the skull. You cannot let such delicate tissues of your brain to touch such a hard component like your skull. And as it was dripping from the unknown destination of this hole, the cerebrospinal fluid kept decreasing and decreasing in volume, caused her symptoms to appear later on. The headache she's suffering is because she has less and less volume of cerebrospinal fluid to keep the trauma against the gravity of her kneeling. Her brain was literally touching her skull and causing headache, dizziness, and loss of balance. Some might ask, doesn't our body produce cerebrospinal fluid? It does. Every day it gets filtered and cleaned, but when she started the dripping the first day of her symptoms, it was slow. After 2 months, it's dripping non-stop, which means she is losing cerebrospinal fluid more than her body is producing per day. And if we leave this, it could end in a disastrous way. We're talking about death. Dr. Emily explained to Shamika, if we don't stop this leak, you're leaving your brain exposed. You could get meningitis. The moment she said meningitis, she saw the fear in Shamika's eyes. The same fear she feels every time she tells a patient about something unusual or dangerous about their health condition. Now, the results came back from the laboratory. It is confirmed. This fluid is coming from the cerebrospinal fluid. The imaging came back. Sure enough, there was a defect at the base of her skull, a gap in the bone of the sphenoid sinus. Now, we have to know where is that hole. There's a procedure where they inject her from her spinal cord with a dye, colorful dye, and they see where the dye goes using an MRI machine. If the dye shows in any unusual destination, that will be the location of the hole. Now what to do next? They took a tissue from her nasal cavity and used it in another procedure to close the hole. Dr. Emmeline will never forget the moment she closed that graft. The weight lifted in a way more tangible than the relief on her face. A week later, Shamika walked out of the hospital a different person. She said her head felt lighter, she felt stronger, she could breathe, sleep, even talk normally again. The leak was gone. Dr. Emily have fixed many sinus problems, deviated septa, chronic rhinosinusitis, polyps, but this was different. It's a rare medical condition, an uncommon health condition. This was life or death, and Dr. Emily was always humbled in this job by how easily a runny nose can mask something far more dangerous. By this, my friends, we finish our uncommon story for today, a real story. Support this video by giving it a like and a share. And have a nice, common, fine day.